All right. So thanks so much for being on the Friends with Wheels podcast. I appreciate it. First question that I have for you is, tell the audience a little bit about yourself and what you do, and we can go from there.
Yeah, sounds good. I'm Emma Dotson. I'm a nurse practitioner, and I specialize in cognitive neurology and dementia care. I currently work at Swedish Medical Center at the Center for Healthy Aging in Seattle, Washington. I'm a nurse by trade, and then I had my advanced practice training in advanced nursing practice. So I have a doctorate in nursing on top of my nursing experience. And I started my career working in inpatient neurology as a bedside nurse, and then I moved to Washington to pursue my doctorate, and simultaneously worked in inpatient psychiatry while receiving my doctorate. And then now I'm in the dementia space.
So let's talk a little bit about the ins and outs of what you do. What's that all about?
Yeah, so I work in a clinic setting, so outpatient, and I see primarily people with concerns about dementia or who have established dementia. I also see people a little bit younger, like in midlife, who want to talk about dementia prevention. I'm going to start working with our women's brain health clinic later this year, where we focus on perimenopause and menopause transition in women who are at risk for Alzheimer's due to family history. And I also offer cognitive behavioral therapy for insomnia. So I work with clients one-on-one on treating insomnia, which we know is a risk factor for dementia.
hmm It's interesting that you mentioned dementia because I had a guest one time talking about dementia, and she said the difference between Alzheimer's and dementia. Alzheimer's is a type of dementia, and there's different types. There's early onset, and then there's like the typical one that you sort of develop in your later years.
Mhm.
So could you talk a little bit about the dementia and the ins and outs of it?
Yeah, so dementia is just this really broad umbrella term, meaning somebody has cognitive impairment that affects their daily functioning. And then there are these different types of dementias under that umbrella. So Alzheimer's is the most common dementia in people 65 and older. Then we have Lewy body dementia, there's Parkinson's dementia, vascular dementia. Many people can have a mixed dementia, meaning they have multiple pathologies in their brain that are occurring together, causing their symptoms. And then we define like an early onset versus late onset by the age of symptoms. So if somebody had symptoms before age 65, that would be an early onset. And if they had symptoms later than age 65, that would be a late onset.
hmm What would be some sort of a test or assessments that you would use to determine whether someone has early onset or, the typical dementia between 65 and older?
Yeah, I mean, I would say we just based on the history, we would go by like when their symptoms started at what age. But earlier onset dementias do tend to be more rapidly progressive as opposed to later onset. So they generally have uh, their symptoms are a little bit quicker in their progression, but it really is based on age.
hmm What about the other types of dementia? I know you mentioned vascular dementia and other types.
Yeah, so like vascular dementia is typically from either multiple strokes in the brain or if somebody has quite a bit of vascular plaque. Usually, those individuals have vascular risk factors such as high blood pressure, high cholesterol, smoking, excessive alcohol, diabetes. So, these vascular risk factors place them at risk for that plaque forming in the small vessels, or they can have the strokes, and that can cause a vascular dementia. But I would say it's pretty common that we see vascular co-occurring with Alzheimer's, and it's sort of hard to be parsimonious and say this person has just this type of dementia because when we do autopsy studies, we find that most people have three or more pathologies in their brain. So I see a lot of mixed dementia in my clinic, and most commonly that's mixed Alzheimer's and vascular.
hmm So, with your experience as a nurse and kind of your work as a practitioner, how do you sort of help folks who are going through that struggle of having dementia? Yeah.
Yeah, so like in a new patient appointment, I ask about what symptoms they're noticing and their care partners noticing, what's their functional ability. So what were they able to do before their symptoms and what are they able to do now? Like are their daily activities affected by their cognitive impairment? And then we do a pretty very thorough, comprehensive workup. So we'll check blood levels to make sure there's no micronutrient deficiencies or something wrong with their thyroid or any infectious diseases. We usually obtain a brain MRI to look for any stroke or brain mass, look for any shrinkage in the brain that might indicate a dementia process, particularly of the hippocampus, which we see in Alzheimer's is shrinkage of the hippocampus, which is our memory center. And then we even perform cognitive testing. So we'll do basic cognitive testing in the office and then at that visit. And then we can also refer to our neuropsychologist who does even more comprehensive multiple hours of cognitive testing. So we can really see the pattern of someone's deficits, their strengths and their weaknesses. And does that look like a dementia process? If so, which dementia does it look like? And then we have like access to advanced imaging studies. So, like PET scans. Now we actually have some treatments for Alzheimer's that target the amyloid deposition in the brain. So we have a special scan to look for that. And those drugs can actually remove the amyloid from the brain, which helps slow down Alzheimer's disease.
Hmm. Now, given that given what type of dementia a person may have, is dementia really sort of hereditary, or what are some of the factors that are involved?
Yeah, so genetics can, so having a first degree relative can increase risk for dementia. Dementia is also disproportionately affects, well, I should say Alzheimer's dementia disproportionately affects women. So two-thirds of people with Alzheimer's are women, two-thirds of caregivers for someone with Alzheimer's are women. And so that's a really vulnerable population. That's part of the reason we have our women's brain health clinic. We think that might be related to the menopause transition, although it's a pretty complex interplay of probably many factors. Um, and wait, sorry, tell me again what you asked. I got on a train of thought.
I asked, what are some of the common factors that someone has with dementia?
Oh yeah, and genetics. Yes, that's where I was. Okay. So there's this late onset, which is typically not an autosomal dominant gene. There just might be risk factors or a first degree relative. But if somebody that has a prominent family history or has an early onset dementia, we typically would offer genetic testing because there are autosomal dominant genes that can cause Alzheimer's and frontotemporal dementia, and then sometimes Parkinson's and Lewy body dementia. And so I usually will offer that in somebody who has an early onset, or a very prominent family history with an early onset.
Mm-hmm. And my next question is like the caregivers aspect of this. So how do you sort of help caregivers through that? Taking care if someone is taking care of someone with dementia, how do you sort of help them through that?
Yeah, yeah. I mean, that's a lot of what we talk about in our visits is helping the care partner navigate how to interact and support someone with dementia. And so a lot of it is behavioral strategy. So if somebody is argumentative or they have, delusions or they think something's happening that's not happening. So how we guide the care partner on how to manage that. So not arguing with them, not saying you're wrong, but just kind of going with it, or the path of least resistance, whatever will sort of smooth over the situation, even if we call it like therapeutic fibbing. So even if it's not the truth, but whatever we need to say to sort of ease the anxiety. Also, I talk to care partners a lot about not saying, why don't you remember, or getting mad that they don't remember because it's not someone's fault. And so it's just sort of having to repeat, or maybe you redirect the conversation. We have a social worker that we work with and some other social service organizations in Seattle that can help care partners find caregivers to come in, or sometimes they need to move to a higher level of care, like an independent assisted living facility or a memory care facility or an adult family home. So we often refer to social work to help support them in that way. There are a lot of good online resources with like free webinars for care partners. And information online on how to manage different behavioral challenges that may arise with someone with dementia. I also lead a shared medical appointment series where I meet with patients and then their care partners can join as well. And it's once a month, and we talk about lifestyle modifications like diet and exercise and positive psychology. And it's for the team. It's for, the patient and their family to learn, strategies to help slow down progression of dementia. And there's one session that's called a cognitive rehab, and it's strategies that you can implement in your environment to support memory loss.
Because what I was going to ask is, what are some of the resources available to caregivers that are caring for folks with dementia? I know you said that you have like online sessions, but is there any sort of resources that you use? Because oftentimes caregivers, and I remember talking to this one friend of mine, she was caregiving for her mother who was in her 80s or something at an advanced age. And so she would tell me that, I feel a lot of burnout, I feel a lot of stress. I'm not really sure what the next steps are if I have to um put her into adult family home, or what other resources besides the webinar sessions can
Mhm.
caregivers into?
Yeah, so the Washington Caregiving Journey is a really good resource. The Alzheimer's Association, so they not only have website information and talks, but they have a person you can call and talk to, a dementia care coordinator that can walk care partners through various challenges that arise. There's also a dementia roadmap made by the Dementia Action Collaborative that we have in our clinic that talks about different stages of dementia and what you can expect. Um, and yeah, I would say those are probably my best resources. And then if somebody has access to social work in their clinic, I mean, I think that's really, really, really critical to have somebody that can meet with the family or the care partner one on one and kind of personalize what they need help with.
What have you learned in doing this kind of work with people that are, with dementia and all that that group in particular?
Yeah, I mean, I think I've learned to sort of meet people where they're at and just, work with them and use shared decision making. So talk about like what's important to them, what are their goals, and how I can help them achieve those goals. And dementia is a diagnosis no one wants to hear, and it has a really, it's a negative connotation to it, but I do try to instill a lot of hope in people that there are things you can do with your lifestyle, because 45% of dementia is preventable across the lifespan. That was a big study that came out of the Lancet that continues to be updated, and we continue to find more and more modifiable risk factors. But I talked to them about how those lifestyle factors can also slow down your dementia, and you can always grow new neurons in the brain even when you have a dementia process, which will slow down the progression. And that's with diet and exercise and managing those cardiovascular risk factors, good support, making sure you're not on medications that are harmful. And so there's all these things you can do that are in your control to help your brain. So I try to really emphasize that at all of my meetings with patients.
hmm And what could be done to address sort of the stigmas around dementia and all that kind of stuff?
Yeah, I mean, I think it's a good question, and I think part of what I can just do personally is I do talks for the community, and I talk to other clinicians in primary care in particular, and some neurologists, and I think a lot of providers don't really know that there's a lot you can do for dementia, but we really do have a lot of evidence. So I try to really emphasize like sharing with the patient, if they have a dementia diagnosis, that there's things they can do that are in their control to help themselves. And how can we support that? So like our shared medical appointments is really practical information on how people can create goals for themselves on their exercise and their diet, and how can I meal prep and create meals that are easy and inexpensive that are going to help my brain. So we really get in the nitty-gritty of practical skills, which I think is important. Um, yeah, so I try to really, really emphasize like what can we actually do to help you.
hmm And lastly, what two tips or resources would you use to sort of help those who have a family member in that similar situation, with dementia? What tips, advice would you give to those, who are going through that process of like caring, giving for their loved one?
Mm.
And yeah, what tips, advice would you give them?
Yeah, I mean, I think I've seen so many very devoted spouses and friends and family members, really wanting to give it their all, which they, as they should. But then I feel like a lot of times people neglect their own self-care. They just don't have time or they don't have the finances. So I would say like if someone is in a predicament where they are caring for someone with dementia, to reach out to the resources available with the Alzheimer's Association, to social work at their primary care office or their specialist office, to just get ahead of things, because it's good to start planning early and have an idea of what resources are out there to help now, rather than when somebody's in a crisis. Making sure they have an advance directive and power of attorney filled out is really important. Um, getting doing what they can with managing their other health conditions and making sure they're eating well and managing their diabetes and exercising and getting those things on board sooner rather than later, because it's
Hmm.
making a difference with their
Yeah,
brain.
I know you said something about the Alzheimer's Association, but what other resources can other people look up online or consider, to find out more information about Alzheimer's, what they can do to treat, someone with Alzheimer's, where to start, I guess?
Yeah, so the Dementia Action Collaborative is one with Washington State if they live in Washington. And the Washington Caregiving Journey is another really good resource. Those are probably the top few I recommend.
Hmm. What are some of the things that people can do to sort of educate themselves on, Alzheimer's and, for those who don't know who don't know what it is, like that are curious about, or just you know someone that has Alzheimer's, but what can what how important is that education aspect piece of it?
Yeah, I mean, I would say it's important because the changes in the brain occur decades before someone presents with symptoms. So if somebody's developing symptoms in their 70s, we're looking at like 40s and 50s when these changes are beginning. So that's really like midlife and a lot younger than people realize. So, I mean, I think like the Lancet study that came out on the 45 dementia is 45% preventable across the lifespan. I mean, I really recommend people looking at those risk factors and talking to their primary care provider and other provider about how they can minimize those risk factors, and thinking of this more upstream, especially if women, because they're disproportionately at risk, or women that have family history of Alzheimer's. I think getting an appointment with someone to talk about prevention in midlife, especially during that menopause time, is really important. But there's a lot of really great resources and talks on the Alzheimer's Association website. And then there's often like senior centers will have talks that are really useful. I mean, I have a number of talks on YouTube as well, and some of my colleagues. So, if there's some sort of offering on prevention wherever someone lives, I think that would be a great thing to learn earlier, to just know the signs, because too, a lot of people don't know what's normal aging versus abnormal aging, and so I think it is important to hear about those red flags, like if somebody's forgetting information, and it's pretty common that they're not remembering conversations, they're getting lost, they're not able to manage their finances anymore. Maybe they have significant word finding challenges that is affecting their ability to communicate. Those are some red flags for dementia, and so it's good to know that that's different than normal age-related change, which might be a little bit of forgetfulness, or maybe we lose things, but we're able to retrack our steps, and but we're able to take care of ourselves, and it's not affecting our daily functioning. So knowing that difference, I think, is important.
Hmm. All righty. Okay. Okay.